name's Abby, and we also have here Abigail, Camille, and Eve. And we are four psychology students that have been working on our senior project over the last 2 quarters. And for our senior project, we've been focusing our research on the influence of parent-child relationships on adolescent disordered eating behavior. So today we are going to talk to you about this research that we've done. We're going to start with an introduction just to get us all on the same page of what this topic involves. And then we're going to dive into these different components of the parent-child relationship and disordered eating. So we're going to talk about parenting style, attachment style, and parental feeding practices. And within parental feeding practices, we're going to hone in on pressure to eat, restriction, and mealtime practices. And then finally, we're going to talk about a specific intervention that we've read quite a bit of research about, and that's going to be family-based therapy.
Throughout the presentation, we're going to be using the terms eating disorder as well as disordered eating, which is defined as disorder. It's defined as sitting on a spectrum between normal eating and eating disorder, and it may include symptoms and behaviors of eating disorders, but less frequency or a lower level of severity. Disordered eating may include restrictive eating, compulsionary eating, or irregular or inflexible eating patterns. We chose to talk about disordered eating because it is very prevalent within the US. 22% of adolescents in the US exhibit disordered eating behaviors. Along with it being widespread, it's also pretty severe. Eating disorders rank as the second leading cause of death within psychiatric illness. So what we wanted to do here today is provide a broader perspective on disordered eating behaviors and treatment within the nutrition field.
As you all know, there are countless environmental and biological influences on the development of disordered eating behavior, some of which include family, culture, media, peers, genetics, trauma, and mental health issues. We chose to focus on the influence family has, and more specifically on the parent-child relationship, because conversation and curriculum around disordered eating development often focuses on the other influences listed in the prior slide, like media, culture, and peers. And to explore how these complex family dynamics relate to disordered eating, we researched parenting style, attachment style, and parental feeding practices in relation to adolescent eating behavior.
All right, so the first component of this parent-child relationship that we focused on was parenting style, like I mentioned. And first, just an overview of what parenting style is. It's going to be the adult approach to parenting characterized by these few things. It's going to be the levels of warmth, monitoring, care, and control. And these four here are the most commonly used terms to talk about parenting styles. The first one is authoritarian. That's going to be low warmth and high control. Permissive is high warmth and low control. Neglectful, low warmth and low control. And authoritative, which is high warmth and high control. So there's a lot of research that talked about this adverse relationship between these parenting styles and disordered eating behaviors. One study specifically found a correlation between mothers who were authoritarian and children with these disordered eating behaviors. However, there was no correlation with a father's parenting style, so that was an interesting note. There was another study we found that looked at neglectful parenting style, and it was associated with disordered eating patterns among adolescent girls. And then finally, there was a study that looked at the child's perception of their parents, and those children with the perception of an authoritarian and neglectful parenting style was associated with the child's disordered eating behaviors. And this last one is interesting because it really highlights the child's perception as being that key factor. So even if the parent doesn't think that they are authoritarian or neglectful, it's that child's perception of their parents' parenting style that really influences the correlation. And then we did find some favorable associations as well, some of which I have here. So the first one was a study that talked to both children and their parents. And the study found that the children with authoritative mothers were less likely to exhibit these disordered eating behaviors. And then there was another study that found a negative correlation between eating disordered behaviors and perceived authoritative fathers. So again, this is that perception piece that is so important to take into consideration.
All right, so moving on to attachment style. Attachment theory describes how a child is bonded to their parent on an emotional level. And this is informed by the extent to which a parent makes the child feel safe, seen, secure, and soothed. And attachment styles can be defined as secure or insecure. A secure attachment style provides an individual with security and the ability to regulate their emotions. And insecure attachment styles are composed of three subtypes, including an avoidant or dismissive attachment style, which is characterized by a state of hypoarousal or shutting down or freezing, and the overall avoidance of a caregiver in response to not having their needs met. An ambivalent or anxious attachment style presents itself as heightened anxiety and a state of hyperarousal, which would look like fight or flight or being on high alert. And then finally, a disorganized attachment style is often unpredictable and may appear as a combination of hyperarousal and hypoarousal, which often results in a sort of emotional dysregulation. So research shows that having an insecure attachment style may act as a risk factor in the development of disordered eating behavior. Participants with eating disorders struggled more with attachment, negative thought patterns, also known as maladaptive schemas, and sensitivity to rejection from others. Maladaptive defense mechanisms could serve as a possible link between insecure attachment styles and eating disorders. So, in other words, the insecure attachment style may contribute to the development of eating disorders because that individual is more likely to use a maladaptive defense mechanism like disordered eating to regulate their emotions. Finally, eating disorder patients with insecure attachment also report higher rates of more severe separation anxiety symptoms in early childhood, suggesting another possible connection. Further research also suggests that having a secure attachment style can serve as a protective factor for the development of disordered eating behavior. In both male and female participants, having a securely attached relationship with their mother predicted less severe eating disorder behavior, and lower rates of binge eating symptoms were found in participants who reported a secure attachment style with their father and those who had the perception of higher levels of care from their father.
So to get more into the parent-child relationship when it comes to feeding and eating, we're going to talk about parental feeding practices. And this basically encompasses the way the parent informs how the family or the child eats. And we're going to look at pressure to eat, food restriction, and mealtime practices. So pressure to eat is what it sounds like. It's pressuring a child to eat more than they want to, and this can look like attempting to encourage the child to eat more, forcing a child to finish their meal, and using guilt tactics such as like some kids don't have any food, we shouldn't waste food, finish what's on your plate, anything that is getting the child to eat more than they would otherwise. And then restriction is restricting the access or amount of food, so just the opposite. This can look like refusing to provide snacks because a meal will be provided later, which is super common, restricting portion sizes at meals, and placing time restrictions on when food is accessible, which is similar to like the can't have a snack now, there's a meal later. So just restricting the food any more than the child would otherwise want to eat. So the impacts of pressuring or restricting a child with their food, both of these are, associated with higher rates of disordered eating, especially among adolescent boys. When it comes to adolescent girls, they are more associated, their higher rates of disordered eating are more associated with their mother's restriction. So the way that their mother restricts her own food. has a stronger correlation with the daughter's disordered eating than among adolescent males. And in emerging adulthood, which is the sort of 18 to 22 range of development, there's an association between pressure to eat and restriction with future chronic dieting, again, for males. So other factors, such as the ones we mentioned early on, like the societal peer factors, may be more predictive, but limiting both pressure to eat and restriction can be a protective factor for the adolescent.
Within parental feeding practice, we also looked at mealtime practices. So that's just how a family will engage at mealtime. And what we found was that families who report having more regular meals together are less likely to have adolescents with disordered eating behaviors. Specifically, we found that regular family meals decrease the risk of adolescent females adopting dieting practices as well as extreme weight-related behaviors. But then for adolescent males, we found that regular familial meals reduce the risk of them engaging in unhealthy weight control behaviors, but had no real effect on their dieting behaviors. With that, we understand that mealtime practices, having regular meals, can be a protective factor. However, their amount of protectiveness is dependent on other negative behaviors that might be present in the family, such as weight-related teasing, was one that was very predominant. With that all being said, what we learned through our research was that the family is super important, or could be super important, in the development of disordered eating. And so with that, we looked at the intervention of family-based therapy and the role that family can play in the treatment of disordered eating as well. Family-based therapy for eating disorders involves guardians coaching them to supervise their children's eating behaviors and empowering them to take more of a role in their child's recovery. Family-based therapy does not focus on identifying the cause of a behavior, but rather it attempts to develop solutions for their behaviors. While individual therapies are more commonly used than family-based therapies, research has really been showing that family-based therapy has promise as an effective treatment. Adolescents who participate in family-based therapy experience significantly more benefits than those in individualized therapy when analyzed 6 to 12 months after treatment's end. One study also noted that 79% of adolescents who engage in family-based therapy are in remission after 1 year, compared to 67 of those who participate in individualized therapy. So we kind of think that these illustrate the power that family-based therapy could have.
And while there is some overlap between the nutrition and psychology fields, we wanted to provide you with resources for referring individuals to family-based therapists. So Headway.co is an online platform that helps users access information to mental health care providers using location, topic of concern, and insurance. And this resource allows you to further filter the database by availability, gender, ethnicity, modality, medium, and more. And then 2 resources recommended by the National Eating Disorders Association include ANAD, which is another online treatment directory that has different providers for people struggling with eating disorders, including family therapists, and Feast, which is a resource for parents of children impacted by eating disorders. And in addition to providers, this website includes information on support, education, and other resources.